When I was born, I was a meconium aspiration, and so very shortly after I was born, I stopped breathing. They called in all my family from across the country to tell them to say goodbye to me because they thought I was gonna die. I was intubated and placed on what's called the jet ventilator. The jet ventilator was new, so Parkview was the only hospital that had one at the time, and they were going to fly me to Riley, but I was too sick at the time to fly to Riley. So my neonatologist would sleep at my bedside, making sure I was okay, and all the nurses took very good care of me. One of the nurses, actually, when they didn't think I would make it through the night, went to the chapel and had a stone blessed and placed above my isolette. Miracles really do happen. I made it through the night and then slowly began to improve from there. And I spent 2 weeks in the NICU and came home on Christmas Day. My mom told me the story of how I was born in 3rd grade. And up until then, I was a diehard, I'm gonna be a dolphin trainer, nobody's gonna change my mind. And after hearing the story, I always have loved kids, and I was like, I think there's something so beautiful about someone that was so important in their life, the care that they provided, and that's what stuck with them. I wanted to be someone that could provide that care to families and help them in that traumatic time in their life and help heal babies. I have been a NICU nurse for 10 years. I spent 7 of those years on the NICU transport team, and in this last October, I just transitioned to the NICU NPD practitioner. We go by either flight or ground, and we go to pick up neonates from community hospitals and bring them back to Parkview Regional Medical Center to receive higher level of care. So working in the NICU at Parkview, I actually do work with one of the respiratory therapists that took care of me when I was in the NICU. We discovered it just having a bedside conversation, and it just kind of came out that, hey, I was born in the NICU in 1991. She's like, I worked here in 1991, and we discovered that she was the one that took care of me. And I'm like, I'm okay. You did great, thank you.
Certain of our babies are easy to remember because they were so critically ill. Babies that we never thought would live, and then they did. And it was just such an amazing miracle. Those babies really stick. And Chelsea was one of those because she wasn't expected to live. When you're taking care of that little tiny baby, you just don't expect that, oh, I'm gonna be working with them. That's not even something that crosses your mind. Chelsea was meant for great things. I can even think of a time when Chelsea was newly doing a procedure, and I was standing outside the room and I'm tearing up, like as if it's my own child. And yeah, I'm like, I'm your NICU mom.
She likes to call me her baby, and I love it. She has a very special place in my heart.
Chelsea and I do have a special bond. I cherish it. Knowing that she was critically ill and now she's caring for babies just reinforces the miracle of what we do.
So it's nice to know and just have that connection of someone that saved my life, and now I get to work beside her and work with her to help save other babies' lives. Like, it's a very surreal full circle moment, and like it just feels like it's where I'm supposed to be. Seeing the care that Parkview provided me when I was a baby has driven me to be really good in my field and to be the best nurse that I can. And that has helped me help a lot of families, and I love every minute of it.